So, hi to all the viewers. So, today is a very happy day for the Doc Tutorials family and for me personally because I have today with me a proud achiever of All India rank number 26 in the recently conducted NEET SS 2023. So I have with me Dr. Bhawani Shankar, who has cracked open the NEET SS in his very first attempt right after finishing his MD exam. So hearty congratulations, a huge and a stupendous achievement, Dr. Bhavani Shankar. A big congrats from our side.
Thank you so much, sir.
So how do you feel right now? Can you
Sir,
relive the moment when you have checked the rank and you have found out that we have secured rank
sir,
number?
I checked 3, 4 times and I sent a screenshot to you. Also, because I can't believe that I can get this rank. I was so
Okay,
amazed, sir.
okay, fine. So, Bhavani, how did you find the exam overall? So, right after leaving from the exam hall, what was your first impression of it?
Sir, questions were tricky, and questions are tough. I haven't heard of all the questions, sir. Like questions were not like out of blue, we can say. They are from the standard topics, sir, like important topics. Yes.
Okay. So, when we did our recall from our side, also the paper analysis session, we have told you that the exam was slightly difficult on the difficult side compared to the previous session,
Yes,
and
sir. It was difficult.
someone who will get a rank of less than 100 should get a mark of around 115 to 120. That was not a prediction from an rough assessment from our side based on our previous experience. Now please tell the viewers how many questions have you got correct in the exam.
Sir, I got 119 correct.
Yeah, exactly within that range. So those students who have got more than 115 questions correct have secured rank within 75, and the top single digit rankers have got more than 120 questions correct. So we have almost got that analysis of the NEET SS paper correctly. Now,
Yes, sir.
Dr. Bhavani, looking back at your journey towards this achievement, so who do
Yes,
you
sir.
want to thank in your, I think it has to be some gruesome journey because you
Yes,
have
sir.
to prepare for the your final examination, MD examination, alongside
Yes,
the
sir.
NEET preparation. So who do you want to thank that for?
Sir, actually, I was giving these random tests. Then I give dog tutorials test. I got good rank there. Then they give me a subscription, and after that, uh, I conceptualize everything. I saw your videos. Actually, started with endocrinology. I saw your all the videos and important QRPs of other subject also. Then I was thinking that everything is covered here, and I got best materials there, and then result is there, sir.
Okay. So how were your college days? So how could you balance preparing for NEET assess alongside your ward duties, your clinical postings, as well as appearing for your final examination?
Yes, sir. Sir, actually, I was in HOD's unit. Here, 10 units are there. I was in HOD's unit. Sir is very like
So,
he
can you
love.
just briefly tell about your college, where you are from, the college you have studied?
Yes, sir. I have done my UG from EMS Jodhpur and done my post graduation from SMS Medical College, Jaipur, sir.
Okay. Now, please continue. Please continue.
Sir, I was in HOD's unit, sir, and sir is like, sir, have enthusiasm in teaching. Someone should be there to teach. Dr. Jay Mathur, sir, is very like this. He loved to teach, and his MCQ book also helped a lot to me.
Yeah. So you want to pay your respect to your teacher also in helping you succeed this journey, right, Bhavani?
Yes, sir. Yes.
Yeah. So I remember, as Dr. Bhavani has told, our first interaction dates back a few months while you were preparing for your INISS Endo April session, and
Yes, sir.
uh, and since then he has been in constant touch with me and alongside all the other faculties. So
Yes,
he
sir.
always, yeah, as he has told, he wants to conceptualize everything, even though he has read, I think he had read Williams cover to cover, right, Bhavani?
Yes, sir.
Yeah. And so despite after reading that, he could find all the materials that we were providing very useful. And so what is your comment regarding the different avenues that doc tutorials is providing, apart from the long subject videos, which of course most other platforms are also giving? So what is your comment regarding the q bank, the qrp session, as well as the harrison tables and flowchart videos?
Sir, these all are from standards books like Harrison and Williams. I seen mostly endocrinology and Williams QR like Harrison tables and QRP sessions. They are very useful, sir. Sir, I read Williams, but I was like getting everything from book is not possible, sir. So I read, but I was not that strong in subject, sir. After I see your videos, everything you covered in endocrinology, sir, there. So that was like booster to me.
Okay, Bhavani. So, what was your approach towards Harrison medicine? You know, it is an exhaustive book, and it is almost impossible for a person to read it cover to cover. It may be possible to read, but to remember and recollect all the information when needed is actually a very tedious task.
Yes, sir.
So, how do you manage that?
Sir, like saw QRP sessions and tables. I read important topics from medicine like multiple myeloma, CML. We got three questions from these topics, sir. Like I read standard text for this, and also seen this video
Yeah,
and all.
yeah, this is a very important point to all the viewers who are listening out there, because as Dr. Bhavani has told, so reading and revising Harrison as an entire textbook, giving equal importance to all the topics, is not possible at all. So you would want to pick and choose the important and the high yield areas. So then the students may be asking, how do you identify that high yield area? So these are the areas where your faculty has included in your QRP. You know, if you go through the neurology qrp by dr rahul sir, or the nephrology qrp by vivek sir, or cardiology by dr kamal sir, or endo by myself, you can see certain points are being highlighted. We are not including all the areas or topics in the qrp. We are focusing on certain areas only. And if you can go retrospectively, you can go back to the harrison, you can make qrp as your primary source of information, then go and read retrospectively harrison in a more detailed fashion, so that you can have more touch and recollection as far as the harrison topics are concerned. Now,
Yes,
so
sir.
one of the other interaction, other prospect that the doc tutorials is providing is the numerous number of test series. We are providing around 17 or 18 grant tests for
Yes.
this subscribers. So how do you find the grant test, and how do you rate that the importance of attending grant test on time to assess your preparation?
Sir, actually, I gave all the grant tests, sir. I have not done much MCQ from QBank, sir. I have done all the grant test and allied series, sir. And grant tests are from directly Harrison, sir. Nothing extra in that. Matlab,
Okay,
some important topics are covered, but mainly from Harrison, sir. And
so
if we see questions, then we never forget that.
okay, so what was
And
the average rank that you were getting in the
sir, I
grant?
was getting around mm, within 50, around 50, sir.
So that actually itself has mirrored in the final examination as well. So this again is a testament to the fact that most of the top students who are eventually going to get top ranks is actually giving the doc tutorials, GTs as well. So you would get an almost accurate assessment on where you stand, and there you can have an analysis of yourself, your strong areas, the areas you need to work upon and improve. That again is a very important point. So moving forward, which specialty do you want to uh, choose as your career?
Sir,
You
earlier
have
I
all
was
options
thinking,
in front of you.
sir, earlier I was thinking of endocrine, and sir, now I will choose probably rheumatology, sir.
Okay, any specific preference for college?
SGPGI, sir. Probably I got
SGPGL.
HSC. Yes, sir.
Okay, okay. Okay, so a final word of advice that you want to give to all the students, especially freshers who are going to be appearing for NEET tests for the first time right after they finish their residency. So, what is your advice on how to balance between both aspects of their work?
Sir, in first year or second year, I will say they see the cases and read the related text to that. And in final year, they can take this subscription, sir, if dog tutorial or second year or final year, sir. Then they can
Okay.
recollect the things they what they have read. It will be very good for them, sir.
Okay. So, Bhavani, one last comment regarding the personalized mentorship that we were providing for you
Oh.
during the revision time of the exams. So, did you find that useful?
Sir, definitely that was useful. I was thinking that how can we get this super specialist on in our phone? Like we comment, we ask a question, and within like 10 minutes, yes, 10 minutes is yes, sir. Within 10 minutes, we get a reply with detail. Like sometimes, sir, you record a video and that send, and sometimes you write. They are very helpful, sir. We feel like connected. We can ask anything there.
Yeah. So I think these are certain things that keeps or makes doc tutorials apart from other platforms, be it the personal mentorship and the WhatsApp discussions that the faculty who is available to you on your fingertips 24 by 7. Then the additional things like the QRPs, the Harrison tables and videos, and we are uh, actually coming with a few more exciting plans as well, which I don't want to disclose it now. That would be very interesting and exciting for the upcoming students as well. So,
Yes.
uh, Bhavani, would you confidently recommend doc tutorials for a person who is aspiring for NEET as examination?
Sir, actually, I was using something else previously. I will definitely not recommend that. And dog tutorial have enough material and good concepts, sir. So I will recommend.
So, okay. So, Bhavani, all the very best for you. Once again, a big congratulations right from my heart for your great achievements. I'm so happy for you personally, also. So,
Thank,
wishing you all the very best for your personal as well as professional life. Thank you for your time, Dr. Bhavani.
thank you so much.
Okay. Thank you.
Okay.